Okay, hi guys. After a long time, I'm back with another academic, very short video. So we are mostly now, we've discussed a lot of a longer lectures. We have discussed a lot of anemias, and we've discussed leukemias. We've discussed the updates that WHO and ICC had. We have discussed techniques like HPLC flow, molecular techniques. We have also discussed how a normal bone marrow looks, how a post chemo marrow looks. So basically, in the hemat spectrum, we were mostly now discussing short things like things which confuse you when you are looking at a biopsy. Like last time, we discussed pink material in the bone marrow. Similarly, today I thought why not let us discuss something known as sometimes we get some sort of pigmentation in the bone marrow. We are getting brown colored or black colored pigments in a marrow specimen in the biopsy or the aspirate that we are receiving. So my thought came, why not let us discuss what are the common pigments that you can encounter in the bone marrow and how you have to approach such a case. So pigments in the marrow, the ones that I have taken are the very common ones that we see. Like most commonly you see the hemosiderin pigment, and the hemosiderin pigment that you see is mostly when the child or the case has undergone multiple transfusions. So that is one moment where you can see hemosiderin pigment in the marrow. There are other pigments also which are brown, yellowish brown, orangish in color, which may mimic a hemosiderin pigment. So we have some special stains for that to differentiate different types of pigments. Very rarely we might get calcifications and necrosis in the marrow. So pink material I have already taken, so I'm not going to be dealing with that. Today let us stick to the pigments in the marrow, and this is a I just have two slides, multiple pics on just two slides, so it won't be very long, maybe just a 5-minute short lecture this would be. So the first image that you see is a bone marrow biopsy. Over here is the bony trabeculae, and then you see some orangish pigments deposited in the normal marrow. These darker blue dots are the erythroid. Here you can see a meg, and of course in between the lighter ones are the myeloid. So this most likely is the hemosiderin pigment. Now hemosiderin pigment, depending on your stain acidity, can be brownish to appearing a bit orangish like this. And the best way, and these are coarse, not very coarse, but they are in between a fine and a coarser granule, so you can see those dots separately, and they are this color. The best way to identify whether it is a hemosiderin pigment or not is do a pearl stain, and in the pearl stain it will appear as a bluish pigment. So when you ever use, most commonly when you see a orange or a brown pigment in the marrow, it is hemosiderin, and do a pearls to confirm, and then you can grade, because hemosiderin pigment also denotes the iron stores in the marrow. That is why in a post transfusion smear, the collection of hemosiderin is increased. Similarly, someone on long term oral iron therapy might have such depositions. Such iron depositions, once they occur throughout the body, is secondary hemosiderosis. Okay. Then sometimes similar in color, lesser in quantity, and within the cell, if you can see over here and over here, you see some orangish pigment, and then you see that there are two dots inside. These are malarial pigments. So sometimes in the marrow, when the malaria has disseminated and is too much, you might get to see these malarial pigments. Contrasting to these pigments, and they are also fineish orangish. Now you come to the coarser looking pigments. So sometimes in the marrow you might get coarse black or brown pigment. Whenever you get that, please look in the marrow for large atypical pleomorphic cells. The most common differential of very mota coarse black or brown pigment is a melanoma, and we do a Mason Fontana stain for melanin to confirm that. Okay, so here you get black, and that was brown. So coarser pigment in the marrow, well, with these kind of big bizarre malignant cells, is a melanoma metastasis. The finer pigments use mostly hemosiderin or malarial pigment. Bilirubin, if the child has kernicterus, or if बहुत ज़्यादा hyperbilirubinemia हो गया, you might get an orangish bile pigment deposition also, but it is very fine and very amorphous. So hemosiderin is medium sized granules. It can be orangish to brownish. Pearls it's pearls positive. If you are getting a melanin, it is Mason Fontana, and they are coarse granules and they are with larger cells. And if you are getting a bile, it is very fine dust-like and orangish in color. In histopathology bone marrow biopsies, you might get something like this. The color will be of hemosiderin, but the texture will be very powdery, not like coarse granules. So this is formalin pigment. This is a deposition artifact, tissue processing artifact. This is not a true pigment. So these are some common pigments that you get in the marrow. If you have any more, you can put it in the comment. These are the ones that I have come across till now in my training of pathology, or since I have been seeing the slides. So I thought, why not share with you that if you get these pigments, these pigments are very good indicator of where the disease is or what the disease is. Someday I'll do parasites in marrow also again once, and just put these random pictures up to show you what different parasites look like. So I think this is, I told you, it's a very short 5-minute video. So I hope you liked it, and I'll see you next time. Bye bye.